Welcome back to Fox 10 News at 4. September is Prostate Cancer Awareness Month. It's a time to highlight the disease that affects millions of men across the country. According to the American Cancer Society, one man is diagnosed with prostate cancer every 3 minutes. Experts say it really is important to pay attention to your body and go to the doctor if you have any symptoms. Dr. William Hickson is in the studio to talk about those symptoms, treatments, and screening tests. But first, I want to go back to that statistic about the number of men affected by this, because it's a lot.
Well, it's the most common cancer in men. There's about 165,000 men will be diagnosed each year, about 31,000 deaths each year from prostate cancer, only behind lung cancer and cancer deaths.
Yeah, and you were saying that a diagnosis means something different for each individual. They're not always treated the same.
That's right. There are, I hate to say this, good cancers and bad cancers and something everywhere in between. If we don't know which one you have, we don't know whether or not you need treatment or not. Early cancers are almost uniformly curable, and if it's more advanced, spread to lymph nodes or bones, the 5-year survival is as low as 30%. So screening does help save lives.
And in addition to the screening, symptoms matter too.
They do. You know, hopefully everyone we see with prostate cancer has no symptoms if they've been caught very early, but obviously urinary symptoms going more often during the day, at night. You can pass blood. In more advanced cases, people can have pain in their back or their bones, representing the cancer being in other parts of their body. Obviously, we hope we don't see much of that, but we occasionally do see that.
Is there a certain age that you like to target in terms of the screenings?
Well, for African American men, screening should start at the age of 40, and it should continue every year. Otherwise, it should begin at 45 and continue through 75. And depending on your PSA number, you might have the PSAs done more often or less often. But even after 75, there should be a discussion with them about whether or not they want to do screening and in terms of their health and what they think about the risk versus the benefits of screening.
Do you think more people are heeding the warnings to this message and they're having those screenings done?
You know, I think there was a recommendation against routine prostate screening, which they meant to say don't do it on everybody automatically, and everyone interpreted that to mean don't get it. So I think that there's actually been an increase in more advanced cancers because there's less screening done. So I'm hoping that people will, through Prostate Cancer Awareness Month, say, hey, I should have it tested. You know, have the screening test done.
Okay, and on that note, yeah, go ahead and get that screening. This is the month to do so. Thank you, Dr. Hickson. Always
Thank you.
An informative conversation. We'll be sure to have this posted on our YouTube page. Look for it shortly and subscribe so you're notified when we upload a new video.